I'd like to call this meeting to order for Health and Human Services, April 8th, 2025. Roll call, please.
Kay Wilson,
Here.
Tweet Schuman, Marshall Savitsky, Chuck Van Etten, Jeff Haney, Bill Trepanier, Dawn Pettit, she's virtual,
Here.
Carol Pearson, Sabrina Dunlap. You have a quorum.
Thank you. Let's stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. An agenda has been set. Do we have any public comments from anything that's not on the agenda?
This meeting was noticed to the news media and the public as required by Section 19.84 of Wisconsin statutes.
Thank you. I missed that one again. No public comment? All right. Approval of the draft minutes from March 11th.
I'll make a motion to approve those minutes.
I have a motion and a second to approve the minutes from March 11th. All in favor? Opposed?
Aye.
So carried. She said aye. External entity reports, LCO.
Bill is not here, but I can do some report outs for LCO. Right now they are, I feel like I'm echoing. Right now they are in the process of transitioning into their new building. They will be closed for regular appointments for 2 weeks, I believe. That started on Monday, correct, Julie? And should be opening up tomorrow for urgent care visits so that they'll at least be able to see patients while they're trying in their transition for their move. So that will be exciting to see that. And then the other thing is LCO had a Falcon community event. Their Falcon is a fentanyl awareness for La Couture Nation. They had the community event to kind of talk about what they're doing for fentanyl awareness, how they're working towards the opioid epidemic, and also how they'll be using their settlement dollars and moving forward with that. They had over 200 turn out. It was a very good meeting. They plan to have quarterly events. In addition, we have Ben Tran is who they brought in to do that marketing and communication plan. He's been working on a number of things with them in other areas and will be joining with the county as we work on truancy and trying to kind of turn the thoughts on the importance of education, getting kids back into school, and we'll be working on a marketing and communications campaign that will go hand in hand with some of the work that we'll be talking about a little bit later. So some really good connections with LCO community.
All right. Senior Resource Center. Do we have any information?
Jeff and I met last month with them and they were discussing that they were approved the Bajor company to redo their roof there with the funds that they raised at that fundraiser back in February, I want to say. And then I believe they're up to staff in both locations at Stone Lake and Hayward, and they are planning out more fundraisers for the summer. And that's about it.
So they are getting their new roof.
They are, yep.
Excellent. Okay, administration.
I think it was last week, we had the Crisis Intervention Partners training, and I think there was 28 to 30 people in attendance. About 80% of our staff, I would say, attended that training. It was a 2-day training, working on understanding mental health, There was a panel, and I keep looking over there because I was sick and I ended up having to miss it. There was a panel there for shared experience, also talked about trauma-informed care, special populations, de-escalation, and there was that role or that sensory, what was it? Hearing voices. So kind of that piece. Anything else I missed? Okay, and general mental health. So something that we now are hoping to be able to become the trainers and be able to bring that to other people in the area who may be needing to understand and work with mental health and potential things that come with that. So there's also law enforcement training that we're hoping to connect to, which is actually a 5-day training. And that is our partners in Bayfield, Ashland, and Douglas County actually have a training team, so we could actually send people up to that. So looking at potentially getting grants to make it so that law enforcement could afford to send staff to that type of training. So I think Andy, did you have anything on an admin update that you wanted to add?
No, I guess the only other thing, it's not on the agenda here, but you'll see on the county board agenda next week, the opioid budget for 2025 is moving ahead.
And that's the one we already brought to you. So we re-brought back the recommendations from this group back to CJCC, and then that'll be moving forward. Any questions for me? Okay. Then we'll move on to C, which is the resolution to amend the HHS fee schedule. And you can see that information. In the fee schedule, we've only included the things that would potentially have changes, trying to reassess and address when we had to do a cost analysis. So looking, while I was bringing it back, trying to move things more into plain language so it makes sense for the consumer as they look at it. Just some minor adjustments. The one thing that we have on there is we had a bunch of different antibiotics. We just threw them all into what's called non-340B. We can order some drugs under 340B, which is special pricing. So we just wanted to make sure that that's clear. And this is discussion and possible action.
We have a resolution before us, which establishes a new fee schedule for DHS. Can I entertain a motion?
I would make a motion to approve this resolution.
A second.
A motion's been made and seconded to approve the resolution for the 2025 fee schedule. Any discussion? All in favor?
Yeah.
Opposed? So carried. Don't forget to sign that.
Oh, do you have one?
Yeah.
Okay. Kay's got it. Okay, just double checking.
So
Okay.
Aging and Disability Center.
Okay, I'm gonna share my screen. I'm just gonna do a replace the current share. Okay, let's see if I can move things around so I can be able to adjust this. So, I'm not sure that I have it all the way up to the top here. Okay, ADRC, they're still having some challenges with that new tracking database. So they're trying to still work out the kinks with that. And that system was also supposed to be able to hold and manage their resource directory database, but that's getting pushed back to the counties, so they're gonna have to kind of reabsorb some of that work that's happening there. We continue to have walk-ins and referrals for long-term care. For dementia care, she had 5 family consults, 2 memory screens, and spoke with 18 people at Weiss County Library, which has been a great resource. She's been going there on a regular basis, and I think that's been helpful to be able to attract people to come in and talk about dementia and memory screens. Elder benefit specialist, as we move forward, had 18 referrals, 182 contacts, 6 walk-ins, 12 office visits. In addition, Hank has put in his retirement plans. So it looks like by June, we'll need to be replacing his position. APS, Rose was gone, I think, has been gone about 2 weeks now, close to 2 weeks. So we are actively recruiting for that. We do have someone contracted to be able to help support at least maybe 15 to 20 hours a week to help with the APS cases, along with Carol, who is our supervisor. So I think those are the key things to share from that group. Any questions related to adult long-term care? Okay.
Moving on to behavioral health.
Can you bring that back up again? Thank you. Printed everything front to back, and then I lose my pages when I do that. Try to save paper, but I get lost. Okay. Behavioral health report has been submitted by Alicia, and I'm not sure that anything new has happened since your report has come out.
No.
Is current. Does anybody have any questions for Alicia related to the behavioral health report? No? Okay. Then we have the community support program and mobile crisis report submitted by Caitlin.
Hey, yeah, not too much changed in the month of February for CSP. Still kind of holding steady at those 48 clients. The vast majority of them are in the community. We have about 11 right now that are in group homes or hospitals, or rather, I should say in the month of February. So, and in regards to mobile crisis, I got 8 contacts from law enforcement in the month of February. 4 of those resulted in assessment. Only 1 person was placed on an emergency detention. 2 voluntarily sought inpatient services, and 1 was resulted in a safety plan. And the other 4 calls that I received, we resolved them over the phone.
I think as we go into March got a little bit busier, so you'll see a little different information as we move forward on that. Any questions for Caitlin?
I have a question.
Mhm.
What is the capacity for CSP right now?
Caitlin, are you thinking that are you asking where we're at or what we could get
No,
to?
we could get to.
What we could get to? Caitlin, what do you think you could get to for the number of clients?
I would say right now with the changes we've had in our crisis program, we're probably pretty close to max capacity, maybe 1 or 2 folks we could add, but I think the state statute, they used to cap it at about 20 clients, and I think that might still be the case, but I think with the acuity of some of our folks right now, we're pretty strapped at the moment.
Mm-hmm. it really, it kind of fluctuates on, are they weekly visits? Are they doing really well and we've got them on monthly check-ins? Are we having to run and manage a lot of things? So,
Yeah, so for example, like right now we have two folks that we have daily contact with for at least an hour. So well, I would say actually it's closer to three folks that we meet with every single day or talk to every single day. So got a couple people that are kind of needing extra support.
so those are the ones that where CSP really comes into play, because if they weren't there every single day, those would be ones that we would be seeing in the hospital or placed in the community and out-of-home placement.
I think it's been a really valuable program for keeping people in their homes.
Yeah, thank you. Okay. The other two reports that you have in here don't have a whole lot in it, but they are our standard report, a little early in the year to be getting information, but nothing outstanding or alarming that has come to point for us. Any questions on those? Okay. Then we could move on to Child Protective Services and YJ. So I'm just going to go into the verbal report for what we have going on in CPS and YJ. We've been meeting and doing some work with LCO, ICW, working on just kind of building relations and connecting pieces. Sarah and I will actually be going to ICWA training, so it's the Indian Child Welfare Act. And that's part of, and involves writing that 161 agreement that I had talked about earlier. So we'll be going to training in Black River Falls next Friday to really kind of hone in and make sure that we're following everything we need to with our ICWA. The other piece that we've got going on, we've got two YJ reports in here. I didn't even notice that. So I could maybe go on into B, and for the YJ report, I'll do that as part of the youth diversion program. We have officially hired a youth diversion and truancy specialist position. We were able to hire somebody who has been working with Hayward School District. So already has some great connections with the school district and some of the kids that we'll be working with in the truancy program. She'll be able to start June 1st. In the meantime, we also have the workers hired for Serona Recovery for the more the intensive in-home program. So we are going to have those workers be able to start working with the families who we have been referred that have had 10-day drops from school. And we are actually going to have letters that are going to be going out and connecting and starting those services now. So we're excited about it. It's kind of building a program. I'm sure there'll be bumps in the road, but I'm excited to see things moving forward.
How many students are involved?
We have 8 referrals right now. And then the other thing that we'll be doing with Serona Recovery is also moving them into some of our YJ cases so that we have some more intensive home going on with some of those YJ cases too. We'll have more truancy cases that we know the referrals will be habitual truancy that's out there. But at this point, we want to just start with those 10-day drops that we've received. And we'll be working with LCO school first on those. Any other questions on that? Otherwise, we'll move on to C, Child Protective Services Report. There, that one. Numbers are fairly stable in what we're seeing. And any questions on that one? Okay, moving on to the YJ report. Yep.
You missed.
Nope, you did it. You got it. You got us the CPS report and then this one. Yep, you got it. Any questions on YJ? We're kind of sitting pretty steady on 7 to 8 out-of-home placements when it comes to YJ. One of the other things that we are looking at is with the YJ program and also actually with the CPS program, is looking at kids that could be getting close to aging out. So on 16, 17 years of age, will they be actually moving into our APS mental health commitment world? So we have some that we're looking at. We have started, I know I've talked about this before, we have these care team meetings that we've been working on. We'll be actually opening up and reviewing some of these cases and trying to make sure that we're having a smooth transition as they get into adulthood, and hopefully can look for some living arrangements that are closer to home and less expensive.
So that would be at 18.
At 18. Mhm. And some of them could be in children with long-term care supports, which then you have that gray area between 18 and 22 on what that transition looks like. So I personally haven't been involved in any of those cases yet, so want to make sure that we are looking at those on the front end. As I know more with those, I'll be bringing them and looking at what are we projecting and looking at. So that will help us really when we look at a 5-year look ahead, what do we know we have coming down the pike? And then we have the children in care expense report, which is the other standard report that has been in there. Any questions? Okay. Then we can probably move into economic support. We have been seeing a number of walk-ins. Oh.
Wasn't
Julia,
that,
I can-
wasn't
I can
that
give an
because,
update.
Oh, Shauna, you're in. Awesome.
Yeah.
I didn't see you join. Now I see you on my screen. Great. Thank you, Shauna. We can hear you. Oh, there you are.
So yes, we continue to see an increase in our walk-in traffic, serving the community. We do the best that we can. It seems to be extremely busy over the lunch hour when staff are out. I know we had that instance today, and what we try to do is just go ahead and schedule an appointment for the member to come back either, later in the afternoon or another day during the week that works for them. So definitely still continuing to see an increase in walk-in traffic. Otherwise, our numbers are staying pretty consistent with food share and our healthcare programs. Childcare families, our childcare team is going to start helping out with the family caseload. We have caseload banking in the Northern Consortium. And so the childcare team consists of 7 staff members, and we're going to get some help in managing the family cases from them. And the purpose of doing that is to try to get some information sent out to members within all of our counties that we serve to try to help more families receive childcare assistance. As you've probably heard, that seems to be a target area for Governor Evers, is to try to make childcare accessible and affordable for families. Otherwise, things are doing well. We're not utilizing overtime right now. We're trying to manage the caseloads as we can right now, and then to save those dollars for when the federal marketplace applications come in the late fall to winter.
Any questions for Shauna? No questions, Shauna. Thank you.
Yep.
Thank you. Public health. Julie?
So my written report is there. I don't know, Julia, if you can start the presentation.
Yep, if I can find it now.
That's great.
There we go. I'm going to have to share here.
That's all good, all good. You also have our community health needs assessment and our community health improvement plan as attachments in your board packet. I'm just going to go over a little bit of the process. I know I've shared with you before, kind of ongoing what we were, where we were at in the process, but this will be a quick overview summary. If you have any questions, please let me know and we'll go from there. So this presentation was given, can you go back to the?
Sorry.
Thank you.
Got ahead.
Sherry Morgan and I did give this presentation to the Board of Directors at Tamarack Health, and now we are presenting it to you. This is a collaborative effort. We have been with the hospital for the last 3 cycles for our community health assessment and our community health improvement plan, and we've really found that there's significant benefit in partnering with our local facility to provide this for our community. You can go to the next slide. So I'll review the purpose and requirements, share a little bit of our process and our plan. And if you have questions, there'll be time for that. Or if you have any feedback for us, please let me know. And then I'll talk about our next steps moving forward with our plan. So both Wisconsin hospitals and local health departments are required to actively engage our communities in the community health assessment and the community health improvement plan. There are slightly different requirements. So local public health needs to do an assessment every 5 years, but local hospitals have to do it every 3. We have chosen to be on the hospital cycle to benefit from the collaborative effort. Next slide. So it is a continuous cycle. So we're always somewhere in the process. This is just the point at which we have written the report that we will submit, both the hospital and the health department will submit to, we submit to the state, so. So basically the needs assessment is to identify, prioritize, and address our health needs in the community. And the Community Health Improvement Plan is the tool we use to forward goals to make progress on those identified needs in our community. We did this in 3 ways. So I did share about our survey, which was our public request for feedback with the community members. We did hold a community stakeholder meeting last October. Over 30 agencies were represented, and we did get feedback, really good feedback from our SWOT analysis to move forward. Out of that stakeholder meeting, we did request and people self-identified to become part of our steering committee and actually give more focus to our goals and our objectives. Next slide. So our survey focused on these 4 areas: healthy behaviors and outcomes, social and economic factors, clinical care, and physical environment. And we asked questions on all of them. We did add new survey questions this round based on some other communities around us and what they were asking. We did want to include emergency preparedness and more areas associated with social and economic factors and unfair treatment and discrimination. So we did request, or we did include questions on each of those areas. Next slide. We did have both virtual and paper copies of the survey. There were 615 total responses. Most of them were online, but we did get some paper copies back and actually reached some populations that wouldn't have participated had it only been online. Just as a summary, we have grown by over 2,000 people since the last census. Our median age is 51.4, which is actually over 11 years older than the Wisconsin average. And our population is relatively equal between male and female. I will say and note, and it's noted in the report, males were underrepresented in the community survey, as were people under age 25. So those were of lower representation. And we did do comparisons with census data for representation. Next slide. The first part of our survey was, what is the best part of our community? And over 68% said the rural lifestyle. So that was actually the most common answer. Access to community parks, trails, green spaces, and recreation activities were also highly ranked. Next slide. Oh,
What
okay.
happened? Oh, we got into, it's not sticking.
Okay. If you can go to the top identified, yep, that's the one.
Okay.
Perfect.
I think I lost the slideshow is what happened.
Yeah, so top identified needs.
There we
This
go.
was the top identified needs based on the survey. So anything that scored over 50% of respondents, we included in this, and there was 12 areas. Drug use and affordable housing were the top two, and they were statistically significant. So no matter what the sample size, those were likely to be the top two responses for the top identified needs on the survey. Next slide. This compares our results. So as I mentioned, our questions were a little bit different, and we did separate out drug use and alcohol use in this 2024 survey. But you'll notice some common denominators from our three cycles. And this is, I think 2018 was the first time that we did partner with the hospital for this. And so this is kind of trends over time. Next slide. The next step after getting all the information from the community survey was to hold a stakeholder meeting. As I mentioned, over 30 agencies were represented. They did a SWOT analysis. We presented survey data, and they gave us a lot of good feedback. From that, the top identified needs from that meeting and that discussion are listed here. So we took all of that data, we took all of the survey data, we asked stakeholders if they were interested in participating in a steering committee, and we moved on to the steering committee. So next slide. The steering team took all the data, and as a hospital requirement, we needed to focus on what we would address and what we wouldn't address. Multiple reasons for not addressing. Some were lower priority on our survey. Some we thought we would have greater impact in certain areas. So we looked at multiple factors. But the steering team identified these areas in blue to address and additional items that they'd like to address that they thought were higher priority. So we took that information and we went back and next slide. The steering team identified priority areas. So we kind of looked at all the areas we wanted to address and we tried to tailor it down. It was pretty daunting because there were so many on the list, but we wanted to make an impact. So we have 3 priority areas here, if you think about them as categories. So substance abuse encompasses the drug use and alcohol abuse that were listed as a high priority. Mental health included social isolation and the basic needs. So this was a reoccurring theme both in the stakeholder meeting, we did receive it on our community survey, as well as the steering team felt very strongly that awareness of resources and basic needs were really important in our community. Next slide. So out of that, we developed, the steering team, that is, developed our 3-year CHIP plan goals, so Community Health Improvement Plan goals. And we have year 1, year 2, and year 3, so things that we can focus on to make progress towards these priority areas. That includes doing gap analysis, looking for what resources already exist so we're not replicating we're not replicating services, but we want to make sure that we're highlighting appropriately using resources that we already have, like the Network of Care website that is already in existence that we can make sure to push out, and also make sure that the agencies on that website are up to date. Year 2, mentioning holding another stakeholder meeting, and actually that was something that came out of that stakeholder group. We had a lot of positive feedback saying that the collaboration at that event was very helpful. Agencies not knowing what other agencies were doing, or not being aware of programs and services offered. So that was something that really rose to the top for feedback from that meeting, and that the steering team felt really strongly to incorporate moving forward, as well as holding a resource fair, or kind of think wellness fair, but knowing the resources in our community. And then moving on to year 3 there, maintaining agency engagement, continuing to work on the work plan, establishing SMART goals for moving forward. Next slide. Do you have any questions or feedback? Okay. And I think our information is on the next couple slides, but I think it's okay. It's okay. All good.
What was the information?
It was our next steps. So
Pull it back up.
it was presented at Tamarack Health. I wanted to present it here before we put it on our website. So the next step, we're going to put this on our website. The steering committee is going to meet, and we're going to have work groups. So people who have identified an interest in working with the basic needs, for instance, or substance misuse, we're planning on holding those to begin the work process. Can you go back up
I'm drawing.
before that one? Okay,
more?
that next steps, yep.
Okay.
So we haven't published the reports yet on our website. They were approved by Tamarack Health, and so they've been published there. I wanted to present them here, and then they'll be published on our website. And then we can continue to monitor progress and report back. We will need to identify and engage additional agency and community partners throughout the process, and to work on year 1 initiatives. So, thank you. Any questions? Thoughts? No? Okay, thanks.
These are adopted and final, correct?
For Tamarack, so yeah, we presented there, and then they didn't have any other feedback, but they did vote to approve them for Tamarack, to move the process forward, as that was a requirement for them. I don't believe it's a requirement for local health to have them approved both. I don't believe so. So this was more of an information and awareness sharing, just so that everyone would be in the loop. If you have questions, do you have questions, or?
Well, one want to know if we should share these with the county board. Like, where else is this being presented outside of the Tamarack? So that the public understands.
So we have to have it public facing, and Tamarack has to have it public facing, and we have to offer written reports upon request. So it's disseminated in that way. It would be appropriate for the county board if interested in moving it up.
Okay. I mean, we can put it in their board.
Packet?
Just want to make sure.
Just put it in the packet.
Yeah, which is totally fine. No,
Yep.
it just has to be public facing. We have to report to DHS. This is a part of our 140 review that we're assessing our community and working towards healthy outcomes. So this is a part of our requirement. But absolutely, it can be widely distributed.
So we'll add that under the report for Tuesday.
Okay.
Okay.
So the
Thank you.
top 3 that you identified, I think, was alcohol and drug use and affordable housing.
So it was drug use on this survey. So if we're just looking at the public information, the top 3 were drug use and affordable housing. Those were actually statistically significant, that those would be in the first 2 spots because of the amount of people who responded to that. The third one, I believe, is alcohol use. A little further down, we though in our plan are combining the two to try to make the most impact and to cover the most area. But that definitely resonated with the public. In the stakeholder meeting, we did get a few other responses and tried to incorporate that, especially with the and actually, affordable housing is a basic need. So they also identified other potential areas that the community would need to be aware and to have basic need information. So that's why affordable housing plus the others came in there.
I noticed that you don't address dental care, and if you go up, I think
Mhm.
dental care was 59%.
Yeah, so there
Why
are,
did you
There's a-
drop that?
so there are a number of them that were prioritized on the survey, as well as prioritized in the stakeholder meeting that we couldn't address. So we looked at capacity, we looked at potential impact, like what our group and what our agencies together could do for impact. So there were things that were identified as issues, but that we either can't address, or we found that other areas were higher priority, or we felt like we could make more inroads in those other areas. So you're right. Dental was identified. I think it was identified on the survey, and it was mentioned in the stakeholder group as well, but not something that we felt like we could make as much impact with our capacity, if that makes sense.
So this process was information gathering, and so the next step was how to address those top three.
Well, it's actually to address all identified needs, and it wasn't just that survey. So it was looking at the survey, looking at our SWOT analysis with our stakeholder meeting, and then bringing that all together, plus other data sources. So we have county health rankings. We have data on diseases and chronic disease. We have data on housing. We brought in a lot of resources and other sources as well as a steering team to look at, to say, what is the priority here? So it was a lot of discussion. Realizing that we couldn't address everything. And the hospital actually has that now in their requirements, that they have to say, what are you going to address? And what aren't you going to address and why? And that was part of the discussion on how we prioritize. What is our highest priority? What do we have capacity for? Where can we make an impact? And move forward from there. But yes, you're right. It's assessment and planning. And that's all a part of this process for implementation and then evaluation, and then we kind of repeat, right? So this part was heavy on the assessment with the survey and the stakeholders. And the plan is our planning piece, right? That's kind of what we worked on with the steering team. And now is implementation. So now is getting together the work plan or the work teams to focus on these areas that were identified and move forward. If anybody's interested in being part of a work, or if any of these areas resonate with you, or you think, man, I would really like to participate, let me know. Let Sherry know. We'd be happy to incorporate whatever agency would like to participate.
Thank you.
Thank you for your time.
Okay, then it looks like we are on to our fiscal area. So we have under A, the standard budget performance report roll-up. And under B, the roll-up by unit. And again, it's early in the year, so not a lot of information there. And then we have under C, the purchase services and revenue recap. We did make some slight changes on the purchase service recap where I had Tanya just add under some of those grants that make us look like we're overspent, stating that that was actually funding that we received, but was not in the actual budgeting, in actual budget. So that looks correct. In looking at this, I don't see anything that's standing out to me as,
I was just going to ask,
Uh-huh.
did anything jump out at?
yeah, nothing's, I did take a second look at it today just to make sure I didn't miss anything. Nothing is standing out at this point. I think one of the things to talk about is, you've heard some of the federal dollars being pulled back, and what does that look like for HHS? There was one grant that we did have some staff time to, that was related to COVID vaccine immunization, vaccination clinic kind of things. That was pulled back, but now that we are in, and I think there was about $11,000 left in that. That's really the only thing that's been affected that we know of so far, but that now was pulled back. We don't know what's happening with that because Wisconsin joined the lawsuit to stop some of those. So from our department, we haven't gotten, at this point, been hit with what we know is going to be coming. We are waiting for one contract to be signed, and so I don't know what's happening with that. But that was really, that was money that was kind of a carryover that we were using, so it wasn't really a ton of staff time or things to that nature. So those two, although it would be nice to be able to have those and be able to finish them off at this point, we don't have any other updates as to impacts. So we'll keep monitoring and watching and let you know as things move forward. Any questions fiscally?
The only thing I just, we know this, but we're pointing out anyway. So under youth aids, under secure detention. So we're hopeful that some of those placements will end this year, but at this point, you've already used about, not half, but in 2 months, you've used about 33% of the budget already. But we increased the budget, but yet we still have those kids in placement, so that's probably the area you're gonna wanna pay attention to as you go throughout the year.
You said 33% is already used.
Yep.
And the transportation. 40%.
Yeah. I think we've got some solutions for the transportation side, but we've got those seven placements that Julia mentioned before. You have them in Eau Claire, Lincoln Hills, or Mendota. Can't remember where the other one is.
Copper Falls.
Copper Falls. So those are your high cost daily rate placements. Now there's potential that they could end this year, but at this point, we're not adding anymore, which is good. But you still have those youth that are in those facilities.
It's just real. It is a reality that we're having to cross.
Well, I'll have to have Mike do his magic with the budget. All right, moving on. Do we have any appointed committee update? Correspondence? Are there any future agenda items? Are there any agenda items?
There's I guess I just scrolled down. I don't know that we've talked about, I want to point out too that the department's really cleaned up the receipt, be page 15C, the revenue recap report. So they've done a bit, as good a job as they can of trying to track client payments that offset the expenses we have. So it's a little more understandable. Probably isn't going to be all that impressive because it probably shows you more so how little we're able to collect. relative to the cost of some of these placements, but I know that had been a question before as to, what does Medicaid, Medicare cover and how much do we collect from private insurance or participants? And that report kind of lays it out for you now. Sorry about that. No other business.
Thanks for the acronym list.
Have you had to refer to it?
Yeah.
Is there any other committee that has that many acronyms?
No,
And it's very easy to fall into that language. So that's why, and even, on the fee schedule, it's like, well, what does this really mean? Let's get some plain language. So we're going to keep working on that plain language.
I think we're adjourned.
Okay, thank you.
Very much for all the information.
You.